discussion. So yeah, if you have any questions, please put those in the Q&A box or the chat box. We'll make sure those are all answered. But thank you for being here today, and we'll go ahead and get started.
Appreciate it, Caroline. Thanks for inviting us. I appreciate Brian and Dr. Misra to join us today as well. Thank you all who are attending. Just want to first, before kicking off, just share deep thoughts, energy, and prayer in whatever form, fashion that you do. Send thoughts and energy out into the universe for all those affected by the pandemic, all those affected and working through the trying times that we're experiencing today across the U.S. So it is in a lot of that energy where we're working every day individually to figure out how we align and utilize that energy that this program actually came about. So it is a natural starting point for us to call out the inequities in the world, from race to health to other, and that's what brings us together today. I'm going to turn it over to Veena here in a moment to share some detail around the Assist Center, which Dr. Misra founded about 8 years ago. She's a professor at North Carolina State University in computer and electrical engineering and the founding director of the Assist Center. Veena and I, through DHIT and Assist, have had a multi-year relationship and engagement, but it's really come to life over the last few months here as we've partnered together on our virtual web series, as well as now launching a virtual incubator. We'll talk about the program, talk about the reason the program exists, and talk about what we hope and expect out of the program after Veena and I give a little bit of background on both Assist and DHIT. So I'll turn it over to you, Veena, and we'll flip through some slides, and you can share with the audience what great and amazing things you and your team at the Assist Center do every day.
Great. Can you hear me okay? All right. Thank you, Michael, and happy to be here today at this Riot event. I will very briefly tell you about what the Assist program is all about, and then leave you with some major remembering points about what we do so we can engage with you in the future, hopefully in a meaningful way. So like Michael said, I direct the Assist Center. Assist stands for Advanced Self-Powered Systems of Integrated Sensors and Technologies. NC State is the lead university. We're working with all of these partners that you see here on the bottom of the slide. We are funded by the National Science Foundation for 10 years, and we're already looking towards applying our technologies towards the NIH now. So if you will go to the next slide. So what is the vision that we have in the center? Well, our vision is in the title. We are trying to create battery-free systems that do not require charging and recharging. And we're applying these systems to have multiple sensors, wireless capability. They are wearable, and they provide continuous data streams. And we are taking these key features of the technology and applying them for health and also a smart environment. So I think the key points here is our technologies that we're building. Let's see, on the left here are wearable. They can be placed on the wrist. They can be placed on the forearm, on the chest. They have energy harvesting on different parts of the body. They are autonomously communicating the data to a tablet or a phone. And so our key features are really listed on the right here. This is what sets these wearable devices a little bit apart from what might be available commercially, is the whole power optimization that we have been performing here. So if you go to the next slide. So this slide gives you an example of the different kinds of research that is being carried out in the center. So since we are building self-powered devices, it's important, of course, to harvest as much power as you can. And in our case, we're harvesting power from the human body. So these are autonomous sources of power like body heat and body motion, but also we take advantage of the power available in indoor solar situations or outdoor solar, and even RF, ambient RF that we have around us pretty much everywhere we go now. So we have all of these sources of power that we harvest through ultra low power management circuits, and we place all this power into supercapacitors. And even with the supercapacitors, we have some innovative designs that have very high performance. And then, but that's not the whole picture. We also have to make sure that every component of the wearable device that uses that power is also optimized to consume as little power as possible. So what are those things? Well, one of them is the radio. Another one is the computational element. And then we have all of our sensors, whether it's health sensors or environmental sensors. We are optimizing all of them to be very low power. And then we are also putting them in flexible textiles-based platforms that can be worn. So our research program is sort of categorized on those 4 lines. So we have energy harvesting and storage, where we are building these flexible materials that can be placed on different parts of the body. You may not be able to see clearly here, but there are liquid metal inside here. And liquid metal, even if you stretch the device, the liquid metal reheals itself back. So it's very reliable. We are also building lots of sensing. We are building both health sensing, like ECG, like Braden here is wearing a shirt that does ECG monitoring, or ECG on the arm or the chest. We're also collecting sweat using this type of platform or flexible patch here that collects and absorbs the sweat, sends it through microfluidic channels, and then in there measures components like lactate or glucose or pH. Another example of that is the wound platform here, which is electrodes that have been printed on a textile fabric to be placed on top of the wound, and it monitors the uric acid changes in that. So this is just a snapshot of the various kinds of technologies that we have been building in the center. We are targeting use cases, so we're very much sort of application driven. So our use cases consist of cardiovascular disease, asthma is another one, wound monitoring, like I just alluded to, and also pre-diabetes, and mostly diet management for pre-diabetes. So those are the kinds of things that we are building in the center. If you go on to the next slide. Yeah, so the thing that I wanted to sort of talk about is we're building first and foremost, we're building cutting edge technologies. They're next generation technologies, but we're not stopping there. We're really trying to take these technologies and advance them into the market, get them commercialized, get them ready to be picked up in a license, for example. So collaboration and partnerships are essential for our innovation ecosystem and critical for our success as well. So in that regard, we're very much aligned with the DHIT's belief in the potential of personal health and personal wellness monitoring is critical for COVID, as we are encountering today, but for many, many health conditions. And so I think it's not any surprise that we are working with DHIT. We have been working also with Riot, one of our innovation champions, on the webinar series, as you have known. And to bring these new ideas via the incubator space, to bring multiple perspectives and players to this field of remote health monitoring. So if you're in the industrial sector, hopefully there are things that we could perhaps work together on. If you're in the academic sector, maybe there are new sensing technologies or new low power technologies that we could discuss. So there are lots of ways to collaborate with us. And I think that's it. I've kept it short and sweet, Michael, just to get the main points across. And
I love it.
Yeah.
Keep going.
All right. Just the last slide that I am representing here also for Adam, and Adam and Michael have been partnering on these webinar series. This is our industry collaboration slide. This is our industry ecosystem. And we have members that work with us at different levels. There are members that are coming from different technology sectors. For example, we have smaller startup companies down here that are very agile and very focused on particular technologies and driving them. For example, Vital Flow is a spin out actually of Assist. DermaSense is also another spin out. But Valence Cell, for example, has been a pioneer in wearables, and we're working with them. Device Solutions and Wireless Research Center are all working with us in different ways. And then we go to the slightly larger, bigger companies like Analog Devices and Murata, and they're actually working with us with technology development, new technology development. And then SAS is working with us intimately in data analysis, and also working with our students as interns, and again, many, many different dimensions of interaction. So I'll just leave it at that.
Yeah, thank you, Veena. And naturally, you know, I think.
Oh, sorry.
Question? Yeah, go ahead.
Question that showed up.
Yeah, we do. Yeah. How do you interact with clinicians at UNC Health, Duke Health, and et cetera?
Sure. Thanks for that question, because we have a great answer to that. We in one of our use cases that relates to asthma, we are building devices. We call them our health and environmental trackers. We build these devices, and we have built 60 of them to date. We've taken them to the UNC, where David Peden and Michelle Hernandez have been testing those devices in clinical studies. So we are currently part of 3 IRB approved studies, and they include regular or normal individuals and also asthmatic teenagers. And we are getting data, and we're getting more insight and getting more publications and understanding and new grants as well to further drive that research. With Duke Health, we are working in terms of building a platform that addresses a pain, indirect measure of how to quantify pain. And that project is being planned out right now, but we have an active collaboration with UNC Health, and we're building with Duke Health, and also we're building collaborations with ECU School of Medicine.
Wonderful. Thank you so much, Dr. Misra.
Thank you.
Awesome. Well, Veena, you can stay on as long as you wish, but wanted to, again, tee up the opportunity for you to share, like you did, the great work at the Assist Center to give context, really, to the program that we're going to highlight together as we move down this hour here. Naturally, when we think about COVID, when we think about health and equity, we think about the gap between our system that is delivering care and the needs of the people that receive care. And I think, you know, we at DHIT, we've been in operation for about 5 years as a nonprofit 501c3 public charity with a mission and vision that is very audacious. To strive for a world without health inequity, and to build a supply chain of global advancements in care to service local need, i.e., our communities on the ground, and doing so in a very personal and measured manner. So what we saw early on, naturally, was that digital transformation, this idea of personalized medicine, this idea of gathering data at the edge and not necessarily reacting to sickness or disease, but being proactive to the insights gleaned from the activities of daily living by our communities. That was our future. So how do we prepare our system, our entrepreneurs, our government, the very many stakeholders across the ecosystem for this transformation? And naturally, in 2020, this transformation, really came, very quickly in front of all of us as it relates to delivering care at home, delivering care through advanced systems, telehealth, remote patient monitoring, et cetera. And naturally, DHIT has evolved rapidly to meet the new demand of services. So we have a multi-pronged approach to servicing our community, from supporting practices in the evaluation and the creation of strategic roadmaps for digital transformation. We host community engagement workshops, now online, but historically through design thinking facilitated workshops. of course, happy hour events, networking events, summits, etc. We have curriculum actual educational curriculum at the graduate school at UNC. Focused on digital transformation. We'll be launching curriculum out of Alamance Community College in Alamance County in the fall around introduction to digital health, giving a new talent stream, hopefully birthing a new talent stream of capable and confident technicians in digital health. We lobby heavily, advocate heavily at the state level to drive awareness to our legislators, our state government, our county governments, county leaders around what is digital health and how can it improve healthcare and health and wellness, et cetera. And naturally launching collaborative programs like the one with the CIS Center here and bringing in our partners like Riot and other to say, look, we cannot operate independently of one another. We have to come together as an ecosystem to service our communities. The types of organizations, the engagement is broad and it's wide because you have to include multi-disciplines, many disciplines in this equation, from med device to pharmaceutical to clinical research to healthcare to entrepreneurs, investors, et cetera. So we try to exist in the intermediary space. We try to exist to be the hub to all these very many spokes. And so you can get just a gist of the types of organizations that we collaborate on a day-to-day basis, and the breadth and scope of our community service over time. The COVID Unites Us virtual incubator is what we're here to talk about mainly, and it brings the power of the research center at the Assist. And the pipeline of technologies that they have in low-powered self-energy harvesting capabilities, and our ecosystem cultivation and partnerships across North Carolina and beyond to drive action and to bring a level of awareness and thought leadership to cultivating, catalyzing, and collaborating across a path to innovation and impact. So, kind of back up with this. About 3 months ago, we all experienced a stop in our normal lives. We were forced, and most of us welcomed the force because we wanted to preserve our health, to work at home, and to exist as much as we possibly could at home with our families. But of course, we at DHIT are very physically engaging organization. We didn't at the time have a virtual presence outside of social media and outside of e-newsletters, et cetera. Of course, we had to stop our in-person events, so no more happy hours, no more physical workshops, not a summit, et cetera. So about early April, I think it was April 3rd, we launched our first virtual web series called COVID Unites Us. That happens every 2 weeks, and maybe about 2 or 3 weeks into that, I got a call from Adam Curry, who is the Innovation Ecosystem Director at the Assist Center, works hand in glove with Veena, and said, "Hey, really love what y'all are doing, bringing this content to the ecosystem. We'd love to partner on the web series with you, and both drive awareness to the Assist Center and naturally see if we can bring and amplify this message to a broader constituency and ecosystem," and said, of course, absolutely, we've been partners and we love what you're doing, and it goes very well with our ethos of remote monitoring personal health. Well, very quickly those conversations evolved to say, what if we what if we, instead of just get together to talk about all these possibilities and talk about all the opportunities and challenges, what if we did something? What if we actually put together an ecosystem, a community that collaborated and built upon these topics and these conversations, and we brought these ecosystem partners together to service these ideas and to help the entrepreneurs and problem solvers out there with advancing their solutions, advancing their ideas, et cetera. And so very quickly, and I think record time, with the help of Brian Cooper, who's online right now, our chief of staff at DHIT, and Adam Curry and the team at Assist, we launched a virtual incubator last week. May 29th was our kickoff, and we're using a platform called Crowdy City, which Brian will give an overview at the end of this brief presentation, and we focused it on personal monitoring. We focused it on how can we utilize remote monitoring technologies like out of the Assist Center to optimize confidence and optimize well-being, at different places of our community, whether it's at home, whether it's at work, whether it's operating across the community, et cetera. So our vision is to service ideas from our ecosystem, our community, and generate a level of throughput to produce actionable applications to solve some of these real problems that we're dealing with. We've got a pretty nice dual track structure that we're operating under. We've been featuring, as of May 15th, the Assist Center in each one of our web series. First, on the 15th, we had a real expose or showcase of all the Assist Center technologies. I shouldn't say all, but a good number of them. And then we carried forward last week with respiratory monitoring and pulse ox discussion. This coming, or I should say next Friday, June 12th, we'll be discussing cardiac remote monitoring. And each episode, we bring together a technologist, a clinician, and an industry member to support from research to from bench to bedside, lack of better analogies here, that innovation pathway. And as you see on the bottom track, we're moving in parallel with this virtual incubator, where we've begun promotion on May 29th and before to start to elicit some of these ideas, and what we imagine it to be and expect it to be an evolving, growing program where the more the ecosystem and the community participate, the greater engagement and throughput of ideas that come through exist. So you see it runs till about end of July, and there's a potential for pushing that back depending on level of engagement. But for right now, we believe this to be about a 4 to 6 week sprint before shortlisting and evaluation, final submissions and awards and next steps shortly thereafterwards, heading into August and thereafter. You can access the platform at dhit.crowdicity.com. That is where the virtual incubator is going to take place. And again, Brian will showcase that here in a minute. But I encourage all of you to join us on the 12th to get a sense of our conversations that we're going to be having, not just in time, but over time, and as well as seek our archive pipeline of past episodes that we featured, previously, from remote monitoring to, health system leaders to urgent care, mental health leaders, et cetera. These are, again, 1 hour webinars that really are meant to drive a top line of thought leadership, a top line of idea catalyzation, and incubate our community to express some of their creativity and innovation through our incubator. we've got a growing list of organizations supporting this initiative. Pfizer Digital is the innovation team at Pfizer. Charlotte AHEC stands for Area Health Education Center. It's Charlotte's AHEC is essentially responsible for bringing best practices and new practices to the community practices and physician population, provider population that are in that catchment area. Of course, Device Solutions and MedX and Riot are organizations that are focused on building and accelerating, wearables and IoT devices, specifically in MedX, specifically to healthcare. And Riot, we'll mention in a moment a little bit more about the award that they're going to be gifting here. Elsevier content. So we'll have ability to pull in really great content from Elsevier and Cone Health Ventures and Accelerate Ventures to evaluate and give a very well-rounded perspective from healthcare to pharmacy to device to investors, etc. We have many different awards that we're going to be offering at the end of this incubator. Like I mentioned, Riot will be selecting an innovation award, an idea or a solution application to enter into their accelerator in the fall. From Charlotte AHEC, Cone Health Ventures, we're talking about subject matter expertise, clinical expertise, potential for testing and validation, and then Device Solutions, and Accelerate Ventures, consulting opportunity. I think Device Solutions has a allotment of hours that they are going to gift to a team for help in advancing solutions, et cetera. And we may have some cash prizes along the way as we continue to source and secure new partners. We have an advisory panel that will be supporting us in ensuring that we stay, again, well-rounded, from Michael Rulin, who's the Vice President of Medical Education at Atrium Health. He's also DHIT's advisory board chair. Of course, you heard from Dr. Veena Misra. Dr. Ian Chain is the Chief Medical Officer at Elsevier Health, but he's also a clinical informaticist and spent many years servicing a number of EMR organizations, from Cerner to NetSmart to working for analytics companies like MedDecision. And then we have Bobby Barham, who's a phenomenal venture mind and runs a great venture organization called Accelerate Health Ventures. So these individuals will help us as we mature and engage with the community as we move forward here. So again, I encourage you all to visit dhit.crowdicity.com. I'm going to turn it over to Brian Cooper now, who is, again, our Chief of Staff at DHIT, and will take you all through a quick demo of the application. And hopefully that will grease the wheels for a level of engagement out of this group here.
Well, thank you, Michael. And can everyone see my screen now?
Yes, we can.
Yep.
Thank you,
Excellent. Thank you very much. All right, everybody. Well, Crowdicity is a very new platform, so we wanted to take the opportunity to give an overview of what it looks like and what's special about it and how to interact with it. So what's unique about Crowdicity is that when you submit ideas, you can actually interact with others. You can see the ideas that have been posted, you can comment, like, etc. And so it really provides this unique approach to open innovation that tries to make it as close as possible to us being in a room together and a workshop, and also helps to address some of the time zone issues, for example, that we have. That we have our webinars at 9 o'clock in the morning, and many people ask, why do you have them at 9 o'clock in the morning? It's so that folks that are in Chennai, India, can attend, 8 o'clock at night, and then folks that are on the West Coast, again, at least wake up relatively pretty early and attend at 6 a.m. But having a virtual landing page like this is pretty helpful to being able to engage people throughout the country and throughout the world. So when you go to dhit.crowdycity.com, this is the splash page that you'll encounter, and there are some tabs at the top where you can do some deep dives, which we'll get to in a second. But you'll be greeted with an introductory video that's about 3 or 4 minutes, just a summary of what we've told you so far, but a little bit more about the process, and easy for anybody that's just coming in off of this from social media, a LinkedIn post or newsletters to be able to interact with quickly. And you'll also see our grand challenges, which are down here. And we actually have intention of creating more challenges as well from a lot of those partners that Michael displayed on screen. Some of them will create sub-challenges as well. So there will be a Pfizer specific challenge and trying to solve a problem set that maybe that they're trying to crack right now. And for each of these challenges, you'll be able to see the activity that's going on, very lively, this particular one. Actually, it covers both. And there's also a point system that every time that you submit an idea or like or comment on something, then you'll receive points in the leaderboards. And just to put a little tease out there, we may provide some rewards or awards themselves, not only for the ideas that make it all the way to the end, but also the folks that have been most engaged with the platform and have really contributed to the community, because we greatly appreciate that. To bring these ideas from just simple ideas to full-blown proposals and submissions, and hopefully developments that help to address COVID-19 and beyond. So if you click on a specific challenge, so we'll go to this one, for example, there will be a more button right here where you can pull down and you can see the specifics of what is the brief, what is the challenge statement as it really is, and some data as well. And I'll go ahead and close that so that we have more room here. You can see this timeline here that, as Michael showed up on screen, that chevron graphic of that funnel process over the next few weeks. Right now, we're in the middle of idea submissions, and our advisor panel will review those, as well as our other partners, and pick out some of the really strong ideas that have sort of risen to the top and are the cream of the crop. And what can we do to really develop and grow those ideas into what a full proposal would look like, and then the final judging and voting of who has really won this not a competition, but who has won each particular challenge. So you'll see these ideas, and you can, we've already got a few populating now, but there are some filters and ways to interact with each one, and like and comment and contribute. And I encourage you that even if you might not have an idea at the present moment to contribute, please take a look at the ones that are up there, and comment and interact with them. And if you for example come from a clinical perspective, and this person is clearly coming from a commercial, help to think about, well, what's the clinical relevance of this, and how can we make this as impactful for protecting providers in the healthcare setting, or engaging their workflow and being able to facilitate their processing. So just all of the different ways that you can get involved here, and it's such an exciting thing that we've launched. So if you go to the activity tab, you'll see deeper dives on the leaderboard and what has relatively recently happened. Michael also talked about the web series, and we do a blog post on each and every one of these web series webinars, which we'll post on here. We also record them as well, and so if you haven't been able to attend the last 4, feel free to watch them, and they are recorded and available for on-demand streaming. So feel free to engage with them. In the community, you can see all of the folks that have been engaging, and already have some folks from the United Kingdom, and I mentioned that some folks attend our webinars from India and from Ireland and Australia, and so being able to create solutions that are relevant not only for North Carolina, but for the entire country, for the entire continent of North America, and then throughout the world. how is it that we can help to address health inequities globally. Partners, Michael had a slide with this, with a lot of the partnerships that we're currently working with. And we invite you too to reach out to us. We have our email address right here that, if you'd like to create an award program for your organization, if there's something that you'd like to contribute to this, reach out to us, let us know. Our advisors, we've also gone over these as well, who will help to, to steer us and to keep us guided and grounded, and even help to contribute to some of these ideas to make them stronger. So that is the platform, and I would welcome any questions that folks may have.
The one thing thanks, Brian. The one thing I'll add is, as Brian and I both mentioned, this is evolving. We're constantly adding to it. You'll see an award section pop up here shortly, a resources section pop up shortly, as well as new challenges. Pfizer will post their own challenge that will be a Pfizer challenge. And as we have additional partners come on board, we'll have new challenges that pop up. So again, this is not supposed to be static. This is dynamic. We want to ensure that this is the beginning to a very continuous and perpetuitous framework for us as we build this community out and service, not just, as Brian said, not just as COVID, but for the health pandemic that we're facing every day. Caroline, I think we've concluded. If there are questions, we'd love to respond to them.
Thanks, Michael. Thank you, Brian. This was really thorough and very helpful. Brian or Michael, could you please pop the link to the idea site into the chat box? There was a couple people asking, they weren't sure how to log into the specific site. If you have any questions, please do put them in the Q&A box or the chat box. We did have a couple of questions that are more specific to Dr. Misra, and I know that she did have to hop off early, so I will make sure that she gets those questions directly. A lot of comments saying how great the presentation was. Thanks, everybody.
And feel free, again, info@dhitglobal.org for questions or intel on the program and or else. We are a very active and very responsive organization. We love our community.
Absolutely. Can't wait for those happy hours to get back in swing. Those are awesome.
You bet. I think everybody at this point is itching for an environment to coalesce and connect that is not through video means.
Absolutely. Yeah, all the questions I see are more specific to Assist. If you guys think you could take a crack at them, or like I said, I can send those directly to Veena, Dr. Misra. We do have one question here. Is there a way you could include a list of the innovations that the Assist Center has developed that could be applied to an innovator software solution or idea?
It's a great question. We will most certainly do so on the resources page once we get that launched. So probably early next week, you'll see that list appear.
Awesome. You see, David, yeah, if you just want to pop your questions into the box, I'll make sure that Michael and Brian get those. Also, we do have Mike Honkamp from Air Electronics on here. If you do need any components or samples for any of your prototypes, guys, or anyone on the line, please reach out to Mike Honkamp. I can give you his information. He works very closely with all the Riot startups. So
awesome. Yes, absolutely. Contact us and we can do have a session, explore, and figure out the collaborative path.
Like one gentleman is typing a couple questions in here. Here's one for you guys. Are any of the devices from Assist available for supervised learning?
I don't believe I can answer that question.
Okay.
I think we're going to have to direct that to Veena.
Absolutely. We'll make sure that Dr. Misra gets all these questions for sure. And then, yeah, again, if you have any assist specific questions, please send those to me and I'll make sure Dr. Misra gets those. I have a question here. Do you have discovery opportunities with patients? I think, again, that one is more towards assist, so.
Well, what do you mean discovery opportunities with patients? Is that doing some customer discovery work, actually in front of patients, asking them, their perspective and thoughts about ideas, or perhaps a little bit more insight into the question would be helpful.
Absolutely. Eric, if you could please elaborate on that question, that would be helpful. Make sure that gets answered for you.
And
while we're waiting on that, Michael, if you just want to remind everybody about your next upcoming webinar, when that will be, and how people can tune in.
Absolutely. June 12th, it will be next Friday, 9 a.m. If you go to DHIT global.org, there is a link to the webinar registration page. It's hosted on Zoom platform, so you'll technically register through Zoom. If you send over your email address, we can shoot you out a registration as well. Brian, am I missing any other aspect? That's about it, right? It's June 12th. We've got
it on LinkedIn as well. If you search for us on LinkedIn, then we have it posted there.
That's right. And we've got another faculty member that specializes in cardiac monitoring from the Assist Center. We've got a cardiothoracic surgeon from Wake Med, and we've got a device commercialization specialist from BML Technologies from Canada, Mark Saab. Really a great panel that I'm excited to co-host with Adam Curry as well, who will be joining me over the next few months as a co-host to our web series and co-host to the virtual incubator itself.
Awesome. Thanks so much, guys. We did have some clarification on the last question. It is in regards to customer discovery. Eric just said it would be nice to present the assist innovations to customers/patients and get the benefit of what they think about the IoT devices. They are a fountain of ideas once they see the hardware.
Yeah, I mean, I think so through Cone Health Ventures, through Charlotte AHEC, we will have opportunities to bring certain ideas to patients. I'm sure of it. It'll be select. It wouldn't be the whole list of technologies, and it would be likely a technology wrapped up into a use case for first level hypothesis validation. Less a open Q&A of what one could do with a type of technology and how they would react to it outside of it being wrapped around with a idea submission.
Wonderful. Thank you, Michael. Well, that is all the questions that I am seeing. I would just like to thank everyone for attending. Again, thank you, Brian, Michael, and Veena for attending. As a reminder, this was recorded, so you will be able to reference this webinar, and you can find that on Riot's YouTube channel and Meetup page. And if you have any other questions or need help contacting Michael or Brian, I'm happy to do that. But thank you so much, everybody.
Perfect. Thank you all. Appreciate it. Hope to see you online. All right. Cheers. Thank you, Caroline. Have a great day.
Thanks, Caroline. Thanks, everybody.
Thanks, guys. Bye.